Welcome to After the Chaos. We have just finished our interview with Dr. Dan Durand and really insightful conversation. Candice and I were both excited about that. We saw his presentation at the Stanford Quality Summit and just had to have him on the podcast. I think there's just so many discussion elements that you couldn't even cover it in 30 minutes, but let's start to break down a little bit some of the topics. I'm curious what you think about that. Kind of the first thing that he addressed is this idea that what if in the future prevention could be done in one visit? And what if whole body scanning, as opposed to the very fragmented system that we have today, like, oh, you're going for your breast mammo, you're going for your colonoscopy, you're going for your prostate health, you're going for, and what if preventative health became one visit? Wouldn't it improve a lot of the problems that we have today in the very fragmented screening process? So, what do you think?
I mean, I love that one. You know how much work we do on population health and screening programs and trying to get patients in for their preventative care. And I just loved that comment because it gave me like a vision of the future that solved so many of the problems that we face when we fragment all of this, getting patients in for their care, managing the follow up, the annual exams, the scheduling. I've been working on a health equity project for mammography up in Wisconsin, and it is so complicated to get our patients in for the care that they need. If are of a certain age, that's multiple screenings a year. These are annual exams. I loved the vision of having an exam, a place to get all of this done. That would transform the way we were able to provide preventative care from the health system perspective.
Yeah, I agree. Speaking of confusion, one of his, I thought, hilarious quotes, I think this won't go over most of the audience's head, but healthcare is like a Rand McNally atlas. And I was like, that's pretty funny. But it's true. Like the health system is this massive atlas of pages and pages and pages. And if you don't know where you are in that atlas, that's very confusing. And
Yeah.
his point about data and AI is becoming like the GPS. And that's really what we're using. It's not just a map anymore of physicians can only read the map. It's literally this consumerism driven product that's coming to forefront. And I think consumerism in healthcare is going to demand things like, hey, I want to come in for one visit and I want it to have all my preventative screens in it.
Yeah.
Um, so that's
I mean,
pretty
I
fun.
think I think that's why this is coming to the forefront. And he said, it's Prenuvo, but it's other organizations are looking at how do we decrease the barriers to access for those who want it, not just those who need it. I think, as a healthy individual, especially as we're getting older, 30s, 40s, 50s, I may not have any symptoms, but the technology's out there for me to get more information about what's going on in here. So maybe I can prevent something in the future. And I think that the population at large, there's a lot of people who want that information, and our current health system just is not set up for them to go access it themselves. And so I think that the demand for these services, not just for screenings, but for just all people wanting to know more and taking more control of their bodies and their health outcomes, I mean, they're really onto something that is going to be incredibly important for people.
Yeah, I just don't think our healthcare system is ready for it. We are set up as a fee for service, symptom driven, basically reactionary medicine. And so this is kind of flipping that concept on its head where people are like, oh, nothing's necessarily wrong. I just want to know what is going on with my body. And I want to do it right now so I can be preventative versus waiting to have the symptom that forces me to the hospital. And I don't think hospitals, health systems, providers, healthcare in general in the US is ready for that. When you go to the doctor and you say something like, oh, I just had this Prenuvo scan and I have all of these findings, I would say most PCPs are gonna be like, "Well, but what's your symptom? Is there something wrong?" And so I think medicine is going to have to catch up to the data that is now at our fingertips. One of the comments that he made that I wanted to get your thoughts on, the data is growing faster than doctors and, going into how much data was produced, from the whatever he said from the beginning of time until 2021, and then literally 2021 through 2023, it like doubled the volume of data. Um, that's the other thing that I don't think healthcare is quite ready for is just this avalanche of data being driven by consumerism in healthcare. And what are they going to do about that? Like they can't just kind of laugh it off anymore and be like, "Oh, you can't Google your symptoms." Because now you've
Sure you
got
can.
ChatGPT Health, you've got like Claude Health, you've got Open Evidence, you've got all of these other, very health focused places. Like, would love to, maybe that's one of our next guests is have somebody on to talk about like how do we prepare the health system for the onslaught of data and consumerism that's driving it?
Yeah, I think you can call it data and AI, but it's information. And this kind of goes back to your mission is like just you just because patients have information doesn't mean they can have care. Like number 1 is we don't necessarily whose responsibility is it to provide the care? Right now you said primary care providers, this isn't exactly what they do. They're going to treat your symptoms, they're going to ensure that like, if there is an escalation of care that you need that you can get it. But these preventative measures increase adipose tissue, decrease bone density, like decrease brain mass. It's all information that needs to be managed. Somebody needs to do something with it. Or like, why are we getting it? The information for information's sake is what makes me so nervous, um, as well as follow up. What if there is something? Can we just talk about the follow up problem of all this information?
Absolutely agree with you. I think if this is right for like whether they do a partnership or what they want to do, but like imagine if they just put a partnership to functional medicine providers and longevity and wellness providers by zip code. And when you leave your Prenuvo scan and you're going back to wherever you live, it's like connecting you to a functional. I think they do a 30-minute like call or like with their team.
Hmm.
But like, what if you want to learn more and you want to go deeper? And like, he told the story of he himself, like what he found in his own body and him wanting to go on a GLP-1 like not that's not necessarily something that Pernuvo is going to provide, but like could they provide the partnership and could they provide the next step for the patient? I think is what we're going to see in the near future. Um, maybe I
But
just
I
use
mean
business
that's
ideas.
the shift away from primary care or the definition of primary care, right? And I think that primary care specifically is at this we're all at the crossroads right now. There's just everybody in healthcare is at an identity crisis. But primary care specifically, there's too many patients, there's too much to manage when they're the ones responsible for all this information. And to our point that we were saying earlier, they're not trained to like do this kind of medicine in this way. And so I think primary care providers, the question is, do I become that type of physician? Do I incorporate these skills in my practice and I become more preventative and I can take in this information and manage it better? Or do I stick to reactive care? And now we have this other type of primary care physician that is now developing in a whole nother practice that is preventative specialty. I think that the shift over the next few years with the access to information is going to I don't know exactly where it's going to go or how it's going to be divided, but there's going to be a shift there that's going to emerge in the next couple of years.
Yeah, I think we all know that we are not incentivized that way as providers, and so therefore unless the incentives change and the entire kind of infrastructure, that's not going to be an easy shift to make because I know when I spend time with my functional medicine and wellness physician, they sit down with me for an entire hour, right? That's not something that is built into this incentive plan for the way that insure or for the way that providers are reimbursed. And so until that changes, I don't think we're going to see any massive change in the primary care or our provider space. One other comment that he made that I thought was really good was that people are hungry for AI, which I think we all know that that is true, and that AI is hungry for data. Um,
Do
that's
you
absolutely. Go ahead.
do you think that changes like I mean, I'm feeling like a change in research, like when Right? It just I feel like there's this shift in, like, the way we define research, the way we define, like, the evaluation of information and data. I don't know, I'd love to get your thoughts. I feel like
No, I think absolutely everything is about to change in the research world. I think it already is. I was I was talking to a friend of mine and he was on a flight recently and flying next to him was this PhD student from like one of the best universities in China. And they were saying how they had to switch majors because basically the research major for pharmaceuticals that they were in would be non-existent in the next, like, 2 years, and they switched basically their major because they were like, "I need to focus over here because this part is not gonna be replaced by AI versus this part is definitely gonna be replaced by AI." So I think you're definitely gonna feel this big, like, shift of I think it's already happening, um,
yeah.
for
I
sure.
mean, I'm seeing it in billing, coding, all of these back office jobs that were absolutely incredibly necessary to organize, synthesize, manage information. If we're in healthcare fields that are managing information, moving it from one place to another, you have to you have to think that that could be a role. That is an opportunity for these healthcare systems to use AI in a really effective way. Now, the clinical application of AI, I think, is a little bit different, although it also is about information gathering and synthesis. I think there's still a role for a clinician in all of that. But yeah, when you're picking where you're gonna go in healthcare, I think you really need to consider, is this something that AI can do? And if it is, then it probably will do it within the next 5 years.
Yeah, I agree. Um, the leadership style, I think his answer was interesting there of, like, his stages that, like, he feels like he's gone through and that now he's at, like, stage 3, and I love that, like, he feels like his leadership now is about talking less and building things with great teams, like, hire great people and get out of the way. The idea that great leadership means sometimes, like, getting out of the way and letting the thing happen. What were your thoughts there?
Yeah, I feel like that's a through line for all of our most successful leaders, is that the most successful leaders are the ones who are paving the way and then getting out of the way, pave the way, get out of the way. Um, and I love that. And I feel like, especially a CMO of such a large organization with such innovation, I really did see kind of like the breadth and depth of like research, application, process. Where does it fit into the larger picture of healthcare? There was so much that he was leading as like a thought leader. Um, Obviously, there's no way he can participate in all of that. And having effective teams in each of those areas really lets somebody's individual expertise be able to be spread so much farther as well.
Yeah. I do. I'll close on this, but I do think that, he makes a good point. In medicine, like, we're very fast to be critics when there's new, and he gave the urgent care example and how everybody was like, "This is gonna be the worst thing ever." Um, and I do think that they are the first, and so they are getting the most, obviously, feedback, but to his point, lots of major, academic and university centers opening the same exact thing, and I love that they're using these data sets and contracted with what did he say? Like, 30 some academic
Mhm.
centers to research, like, what does all this data mean? Like, for the first time, we have the largest whole body imaging data set in medicine, in the majority healthy patients. Um, the application of that into research is incredible. So I love that they're doing that and that they've already like opened up that data set to be like, let's learn, like let's do the needful. Yeah. Fun stuff.
Everything is changing so fast. I find it incredibly exciting to be in medicine right now, in improvement right now, technology, innovation. It's a wild ride. Every time we go to a conference, we meet these people. We're seeing new innovation. We're seeing changes in the way that we practice. We're seeing changes in the way we interact with with each other, with our patients. We're going to be in a new world in a few years here, and it's so fun to witness it.
Yeah, we I am with you. I'm excited about it. I'm cautiously optimistic and, uh, yeah, I think every day I'm, like, educating people on AI, so I see both sides of it. There's a lot of fear, there's a lot of, uncertainty with it that I think we have to kind of guide people through, but I also think that there's a tremendous amount of opportunity, and, I'm glad to be living through this age. Um
Me too.
All right. Thank you, audience, and we will see you next time.
See you next time.